At the moment, Meru County has had 2 confirmed cases, and by extension, we are also having a 3rd case that I'm calling a referral case from Mombasa. The first case, which was confirmed on 16th May, was a case regarding a 23-year-old female who comes from Egonji in Imenti South and works in Kisima in Bore West sub-county. The case is asymptomatic, and it was picked out of our routine target testing by our health personnel. Out of that first case, we've been able to identify or to trace 17 contacts that have been placed in our quarantine center at KMTC. And in addition, we've also been able to trace 15 cases which have been put on voluntary quarantine at home. The 15 people that have been put on self-quarantine are close members of the case in point. All the cases, both in the mandatory quarantine and in the voluntary quarantine, have been tested, and the results are pending. On the second case is a case of that 5-year-old male coming from Getibene in Imenti North sub-county. This case was identified, or rather was picked on 18th, that is the 18th of this month, and it was also asymptomatic. And this case was as a result of interaction with a confirmed case in Garissa County. A confirmed case in Garissa led us to this contact, and upon testing the contact turned positive. As a result of that, we've been able to trace a total of 20 contacts, which have also been put on quarantine at KMTC. And in addition, we've also been able to identify 8 contacts that have been put on self-quarantine at home. Likewise, all the contacts, both in mandatory quarantine and in voluntary quarantine, have been tested, and we are waiting the results. The 3rd case is the case that I'm saying is a referral case from Mombasa. I'm calling it a referral case because this case is of a 38-year-old male who works as a truck driver. He was tested in Mombasa County, and after the testing, he made a journey, what I would call a tour of duty. He came to Meru in the course of his work. And it is while he was here in Meru yesterday that we were notified of the situation. And I'm happy to report that we have been able to get the person. We have put him in our medical care isolation center in Meru level 5. And the case is also asymptomatic, and it is being managed at the Meru level 5. We have also started contact tracing on that particular case, and you realize that now we shall have twofold in terms of contact tracing. One, the contact tracing here in Meru, that is the people that he interacted with in the course of his duty. And also the Mombasa team will also do contact tracing where he resides and his interactions in Mombasa. We shall also treat the same case like the other two. We have a total of other 23 persons that we have placed on mandatory quarantine, which are not necessarily confirmed. And these cases are as follows. We received 11 persons from Mombasa County, specifically Lamu, last week, who are actually residents of this county, and they had gone to Mombasa for work. Then the work was, the site that they were working for was closed, and then they had to come back home. So we received them last week, and we placed them on mandatory quarantine at KMTC. The other group of the 23 are 7 persons that we arrested in our Kina entry point around 10 days ago. And these people were from Wajir County and were being smuggled, let me call it smuggled, into our county by 2 vehicles that had gone to Wajir to deliver miraa. So we were also able to intercept them, and we put both the 5 people and the drivers into the quarantine. They are still serving the quarantine. The other people are 4 persons that we arrested at Kawero, that is in Egembe Central. And these people, 3 were youth. No, 2 were youth from the same Wajir, who are being smuggled into our county using a motorbike. Okay, using a motorbike. So the 2 people and the motorbike riders, we were able to arrest them, and we put them to quarantine at Kangeta Level 4 Hospital. And then there is 1 person who came into our county recently from Kilifi, and we felt it necessary to put him on mandatory quarantine just to ascertain his health status.